On-the-scene coverage of ACC.14 is supported by Janssen Pharmaceuticals, Incorporated.
I'm Alfred Beauvais. I'm here with On the Scene at the ACC in 2014. With me today is Dr. Daniel Sessler, who is a professor and director of the Division of Outcomes Research at the Cleveland Clinic. Dr. Sessler has recently presented some data on a trial called POISE 2, which is looking at improving outcomes for non-cardiac surgery using a couple of different modalities. So, Daniel, welcome to On the Scene, and explain a little bit about the POISE 2 trial.
With pleasure. The background of this study is that among patients over 45 years of age having non-cardiac inpatient surgery, that's about a third of our patients, 8% suffer myocardial injury after surgery. This is much more than people appreciate because 80% are clinically silent. But the clinically silent myocardial injury and the clinically apparent myocardial injury are both lethal, and they're equally lethal. 1 in 10 patients who has a heart attack after surgery is dead in 30 days. We do not know how to safely prevent myocardial infarctions after surgery. We do know a way to prevent them, and that's beta blockers. But beta blockers cause hypotension and devastating strokes and actually worsen mortality. The basis for this trial was to test 2 other drugs that might be helpful. One was aspirin and the other was Clonidine. The basis for aspirin is that aspirin in non-cardiac settings, non-operative myocardial infarctions, is overwhelmingly beneficial. The basis for Clonidine is that it centrally decreases sympathetic activation and thus controls heart rate, and does this without causing too much hypotension. So 10,000 patients were randomized factorially to aspirin or placebo and to Clonidine or placebo.
Okay, a quick word on the aspirin outcome, and then we'll focus a little bit more on the Clonidine outcome.
Aspirin did not reduce the risk of our primary composite outcome of death or myocardial infarction at 30 days, and it did increase the amount of life-threatening bleeding.
Okay, so we get to the Clonidine arm. A logical approach to this would say let's reduce sympathetic outflow. Maybe that'll improve outcomes. So what did you find?
Well, that's logical, but it's not the way it worked. There was no improvement in our primary outcome. That is, the risk of death or myocardial infarction 30 days after non-cardiac surgery did not differ significantly in the 2 groups, and Clonidine caused a significant increase in clinically important hypotension and bradycardia.
Okay, so I guess we have to go back and look for some other agents. Aspirin and Clonidine looked promising logically, but it sounds like you've done a good job of showing that they can cause more complications than benefit. So let me thank you again for being here On the Scene, and we'll look forward to some subsequent studies on your efforts to improve myocardial infarction outcome post non-cardiac surgery. Thank you.
Thank you very much.